The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Hello and welcome to the ASCO Guidelines podcast series, brought to you by the ASCO Podcast Network, a collection of 9 programs covering a range of educational and scientific content and offering enriching insight into the world of cancer care. You can find all the shows, including this one, at podcast.asco.org. My name is Brittany Harvey, and today I'm interviewing Dr. Robin Zahn from Michiana Hematology Oncology in Mishawaka, Indiana, co-chair on the Telehealth and Oncology ASCO Standards and Practice Recommendations. Thank you for being here, Dr. Zahn.
Thank you so very much for having me here with you to discuss this very important topic and work, which was undertaken by an expert panel of ASCO incredible volunteers and ASCO staff lead, Erin Kennedy.
Great. Then first, I'd like to note that ASCO takes great care in the development of its standards and ensuring that the ASCO conflict of interest policy is followed. The full conflict of interest information for the expert panel is available in line with the publication of the standards in the JCO Oncology Practice. Dr. Zahn, do you have any relevant disclosures that are directly related to these standards?
No, I do not have any relationships to disclose related to the subject.
Thank you. Then let's get into the content of these telehealth standards. So first, can you give us a general overview of the purpose and scope of these standards for telehealth and oncology?
Well, absolutely. To serve as background, pre-pandemic telehealth was utilized less than 1% of the time for oncology ambulatory visits, with, of course, a subsequent rapid adoption of digital health in response to the public health emergency. This uptake of technology intervention was then further facilitated by the Centers for Medicare and Medicaid Services' increased flexibility in reimbursement for these services. In response to the COVID-19 pandemic, ASCO published an interim policy statement on telemedicine to signal its positions on emerging policy issues, as well as the Road to Recovery report, which presented ASCO's recommendations for modifying pre-pandemic policies and practices to improve high-quality patient care, wherein ASCO membership identified a need for more detailed oncology-based standards for telemedicine. So these standards were created in response to this need. It is important to note that these standards include an endorsement of existing general guidelines as published by the American Medical Association Telehealth Implementation Playbook and the American Telemedicine Association's Quick Start Guide.
That background and context is helpful for our listeners. So then these standards, reading through them, they address 6 questions. I'd like to review the key points in each section for our listeners. So the first section, which patient should be seen via telehealth versus in-person? And what are the important implementation considerations for oncology telehealth visits?
Those are great questions, Brittany. Generally speaking, patients should always have the option for in-person visits when feasible. But when appropriate infrastructure and personnel are available, telehealth visits are suitable for treatment or long-term management visits, in addition to family conferences, genetic counseling, second opinion evaluations, consent form discussions for pre-research trial participation, or when care access issues exist. I would refer the audience to the bottom line box, which highlights the 18 described visits, as well as the preferred in-person consultation recommendations. So from an operations standpoint, the standards include recommendations for practices to develop their own policies and procedures for these types of visits, frequency of visits, and documentation requirements for all clinical visits. Additionally, patients need to be oriented to the technology being utilized and have real-time access to troubleshooting support if there are technology issues. The panel strongly advocated that quality of care should be equivalent to in-person visits. Thus, to support this concept, the standards include key performance indicators evaluation, policies for interventions delivered asynchronously, automated reminders, and inclusion of patients' and caregivers' involvement if new technologic interventions are developed.
Great. I think those specifics you outlined will be helpful both for clinicians and practices as they implement telehealth. So then, how should the establishment of the physician-patient relationship occur within the context of telehealth and oncology?
Well, both state and federal policies permitting telemedicine to cross state lines should include a provision requiring that the doctor-patient relationship be established prior to provision of any telemedicine services. As a reminder to the listener, the ASCO position statement, Telemedicine Cross-State Licensure, was recently approved by the Board of Directors and references a valid doctor-patient relationship as outlined by the American Medical Association. This includes establishment of relationship by face-to-face examination or consultation with another physician who has an ongoing doctor-patient relationship with the patient, or meets the standards of establishing a doctor-patient relationship if included in clinical practice guideline developed by a major medical specialty society. I would refer the audience then to this ASCO position statement for a much more detailed discussion regarding this topic. Importantly, the doctor-patient relationship should include the usual follow-up and care responsibilities and include opportunity for in-person visits at the physical location of the physician practice.
Then following those recommendations for the physician-patient relationship, what is the guidance for when patients may see an advanced practice provider?
Well, the panel recommends that practices follow established standards, policies, and algorithms that govern when advanced practice providers, also known as APPs, or physicians, should conduct the televisit based on the disease, treatment, or decision inflection point. However, the panel advises that practices should also review and comply with state and local regulations for advanced practice provider supervision, including on how the APPs and physicians form teams.
Understood. And then further, in addition to those, what is the role of allied health professionals in oncology-specific telehealth interventions?
And just to orient the audience, when we refer to allied health professionals, we are referring to health professionals who are valued oncology team members, but they're distinct from physicians and nurses. That said, the expert panel referred to the Clinical Oncology Society of Australia, also known as COSA, Tele-Oncology Guidelines, which provides guidance for oncology telehealth in rural and remote Australia. This evidence base was the largest for allied health professionals' supportive interventions delivered by both telephone and video conferencing. So due to the strength of the COSA evidence base, the expert panel endorses these recommendations and refers to the utilization of telephone-based support systems, computerized screening, hybrid telepractice systems, and video conferencing as instruments for allied services delivery.
Great. And then the standards went into specifics regarding multidisciplinary cancer conferences. So how should discussion occur at virtual multidisciplinary cancer conferences compared to in-person MCC meetings?
Well, as many of you know, many practices in both academia and community settings consider cancer conferences, which we also refer to as tumor boards, as essential for high-quality patient care. Therefore, virtual cancer conferences replace these face-to-face meetings. The expert panel endorses the recommendations by the University of Pittsburgh Medical Center for implementation of a virtual cancer conference. These include finalization of the agenda 1 day in advance, secure video conferencing software, prioritizing complicated cases, and documentation and evaluation guidance. The expert panel also suggests that practices follow institutional guidelines, allowing the discussion to be directed by the presenter, and that there be no recording of the conference taking place without prior legal review.
Once again, I find those specifics will be very helpful and explicit for clinicians. So then the last question that was addressed in these standards, how can telehealth be incorporated into clinical trials in oncology?
Well, utilization of telehealth in clinical trials are recommended as a method for increasing recruitment while reducing patient burden. Importantly, I want to emphasize that the expert panel endorses these recommendations prevail beyond COVID-19 pandemic restrictions. This includes consideration for a hub-and-spoke model for patient enlistment, as well as recommendations to facilitate the conduct of teletrials, which are modifications intended to reduce risk during the pandemic, but also results in increased accessibility, reduced costs, and are less time-consuming.
Thank you for reviewing all of those key statements that were highlighted in the standards. So then, in your view, Dr. Zahn, what is the importance of these standards to clinicians, and how will their implementation impact clinical practice?
Well, as I mentioned earlier, telehealth was very uncommonly utilized in cancer care prior to the pandemic. However, with the soaring use of this intervention, there was a noted gap specific to oncology standards beyond the general telehealth guidance. These standards then are designed to assist the cancer care team in delivering the highest quality patient care. similar to the face-to-face quality care that oncologists strive to provide on a daily basis. Furthermore, what we have witnessed from both the practice responses and the convening of many experts in the delivery of telecare is a flexibility to swiftly change and harness innovation among our colleagues worldwide. Telehealth, then, has the potential to improve care beyond the pandemic, and these standards serve as a roadmap for telecare best practices to continue to develop and address the needs for rural communities, patients with poor access to care, increase overall clinical trial participation, support patient education, and become one strategy in a toolbox of other strategies to help narrow the gap in disparate care.
Great. And then you've started to touch on this already in talking about access to telehealth and how that impacts patients. But finally, how will these standards affect patients?
With regards to patients, what we learned from this evidence review is that patient satisfaction is high, and they appreciate the convenience, flexibilities, and time and cost savings as a result of telehealth options. I can share from my own practice that my patients were very grateful that we were able to provide telecare during the pandemic, and even now, as restrictions lessen, they're very thankful to have that opportunity. Many oncology patients want this option to continue for the future and do not believe their clinical care was compromised. However, oncology patient-reported outcomes and ongoing patient satisfaction evaluations must continue, along with assessment of how the continuing challenges of broadband access, lack of technologic devices, or even familiarity with some technology may serve as barriers to this care model. These standards are meant to assure the same high-quality care for patients who choose to use this intervention as they would if visits were in person.
Definitely. Well, thank you for your work on these evidence-based standards directed at delivering high-quality and accessible oncology care. And thank you for taking the time to speak with me today, Dr. Zahn.
And thank you so very much for this opportunity.
And thank you to all of our listeners for tuning in to the ASCO Guidelines podcast series. To read the standards, go to www.asco.org/standards. Additionally, our annual survey for standard topics is open for submissions. Suggest a topic for standard development at surveymonkey.com/r/standards survey. The link is also available in the episode notes of this podcast. If you have enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.